Okay, so I think we can go ahead and get started. Welcome, everyone. We're really excited to be here. As it says in this opening slide, today we're going to be focusing in on comprehensive workforce plans and how to put them into action. Helen, next slide, please. And just to give everyone, you'll hear me say next slide for a little bit. So Helen is going to be sharing the slides. We're going to do a few Mentimeters, so I will be sharing that. So please bear with us as we kind of go a little bit back and forth with that. But my name is Michelle Fernández Gabilondo. I'm the Associate Director of Workforce Development. Really excited to be here today with Helen Vernier. She is our training specialist and just all around awesome person. So Helen is here, she's on camera, and you'll be hearing from her after our break a little bit later today. So I'm going to start the presentation, we'll have a break, and then Helen will take over to close out. So we are the Association of Clinicians for the Underserved, or ACU. And as you can see from this slide, our focus is that access to care, offering that support to clinicians and everybody working in healthcare. We were started by National Health Service core alumni. A lot of our programming has changed since, but it's still very much at the core of what we do. We look at the transdisciplinary team, and we have many different programs from vision services to suicide safer care. And the program that brings us here today is actually the STAR Center. And thank you, Helen. I think you probably know like when I'll be moving to the next one. So we did get our national cooperative agreement in 2014. We're one of the 21 national training and technical assistance partners. But what I really want to point out in this slide is all of the resources, the training, the technical assistance we offer. It is free, and this is our specific website for our program, chcworkforce.org. And you can also contact us about this training or really any questions you may have around workforce, comprehensive workforce plans at info@chcworkforce.org. In the previous slide, you also saw my email and Helen's, but this email actually goes directly to me and I filter it to our team as appropriate. We did want to announce, we do have 2 upcoming events that link directly to what we're going to be talking about today. So we have our Workforce Symposium and our Retention Recruitment Workshop. That one we have, the workshop, we have filled up all the slots, but we may have a waiting list for it. But the symposium is still open. Very much, as it says there, we're focused on workforce and all of the things that really revolve around that. So a culture of wellness, a JEDI, comprehensive workforce planning. So if you are in Nashville, we would love to have you join us. So today's agenda, we're going to do some welcome, some introductions. The introductions are going to be on a Mentimeter, and what I would suggest is once you open up the Mentimeter, keep it open, whether it's on your phone or your computer, because we'll have a few other ones and we'll open those slides as we go through. As our title said, we're going to talk about comprehensive workforce plans. So we're going to look at the operational assessment, retention planning, recruitment planning, and then close it out with action planning, because as with anything that you do, you need to also put it into action, be able to implement what you're writing down. Oh, yes, Kaylee, you will. So what we understood is that these slides are going to be sent out from the PCA after the presentation. So everyone can have access to these slides. Also, we're going to focus in on a few resources that we have. Yes, we are. So Jenny was asking if we'll be recording the presentation, not just the slides. Yes, we are recording. So all of that is going to be sent out either from us or from your Virginia PCA so that you have access to all this. On our slides too, all the resources that we're talking about, they're going to be linked on there. So they're hyperlinked. If for some reason it doesn't work or you can't access it, you can contact us and we'll make sure to get you all the resources directly. So yep, you will be able to get everything that you need. So as it says here, we have really 3 core learning objectives. It's what's the importance of the comprehensive workforce plan? We're going to be talking about a definition around it. We're going to be identifying those different components that create your workforce plan. We know that there's a really big push for this. You know, from HRSA, from your PCA, the requirements around this, and then the importance of action planning so that you can implement those recruitment and retention strategies. And obviously the end goal is that you are able to be effective in your recruitment and retention strategies, especially right now, as we know, workforce is very complicated. Next slide, please. Okay, so as I mentioned, we're going to start with the Mentimeter. So what you want to do is, if you have your phone, you can put it up to the QR code. It'll automatically open up for you. You can also go to menti.com and put in this code. And as I said, keep it open. Don't close that window because we're going to be using this throughout the presentation. And we just want you to tell us about yourself. And this is really important because it helps us to get to know you a little bit better. So putting your name, role, organization, and the time in your position. If for some reason you don't feel comfortable sharing something like this or some of these parts, that's totally fine, but we would really love to know who's in the audience today and who are we presenting for. So what we're going to do is Helen is going to stop sharing and I'm going to share the Mentimeter. And as soon as I share this, all of you will also see the code at the top. Sorry, you're seeing my email. So if you look up, there is, the code is here. So just go to menti.com and I see, oh yeah, and Helen put the link in the chat as well. So various ways to be able to access it. So I'll give everyone just a few moments to type in so that, as I said, we can all get to know you. And I can also give a little bit more about myself as all of you are writing in. As I said, I'm the Associate Director of Workforce Development. I have been with ACU. It will be 2 years on May 4th. So really excited about that. Before that, I did work with health centers, with clinical workforce at NAC. And prior to that, I was at NAC for just a little bit over 3 years. I worked with sexual assault survivors in the military. Okay, perfect. Now we're getting all of them up. So we have Terry King, HR Director at Tri-Area Community Health, who has been there for about 3 years. Joe Stevens from Richmond. Oops, sorry, I'm trying to get it to scroll up. Senior Communications and Marketing Specialist, 5 months. So wonderful. So you're new to the health center world, or new, or at least in that position. Rochelle in Leesburg, Human Resources for 6 years. We have Tracy, a CEO for 19 years. Joan, Chief Medical Officer, has been the CMO since August, but has been with the organization for 16 years. Sharon for 10 months. We have Helen, Chief Operating Officer and Acting HR Director. So since October 2021, so really coming in right at the height of the pandemic. And then Glenda, HR Director for 20 years. So this is really what you do and what you know. And then Gustan or Justan, I'm sorry if I mispronounce your name. Feel free to let me know, and have been in the role for about 5 months, but work with health centers for 5 years. Wonderful. And also, just so you know, you can go ahead and put in any comments in the chat as we go along. You can, I apologize if you're seeing my chat pop up. You can put any comments in the chat or unmute yourself as we go through the presentation, and you know, we're more than happy to stop at any point and answer any of your questions. Okay, so let's continue on. So what do you hope to learn from today's session? So this is our next question, and this also helps us because as we're going through the presentation, we're able to modify it for what your needs are. So as I said, our focus is comprehensive workforce planning. Our goal is that as you build your comprehensive workforce plan, you are going to improve your retention and recruitment strategies. But at the same time, we want to know where in those areas do you really want to focus in on? And we're happy to modify as we go. So I'll give everyone a few moments and then we'll go back to the presentation. And this can really be anything from, you could just say comprehensive workforce plans, which is exactly what we're going to talk about, but also some key components in there. Compensation, how to advertise. Okay, great. Workforce planning and recruitment strategies. And I'll give it a little bit more time for other people to respond. And one thing is, I'm also a social worker, so I'm very comfortable with silence and just waiting. So there we go. DI considerations for our we are definitely going to be talking about that. We're going to be talking about compensation and incentives. Usually that also creates a lot of conversation around that. So as I said, just go ahead, ask your questions, put in your comments as we go through action plans. It's really going to be the end of our presentation. We'll make sure to go through all that. And recruitment strategies specific for physicians. Great. So one of the things we do focus in on the clinical providers, but really the way that we look at this is that this can be incorporated for any staff. But what we'll do is as we go through, we will mention how you can modify some of this for physicians. Okay, so let me stop sharing so we can go back to our presentation. Yep, and as always, the technical difficulties that we may have. Okay, so if you could go on to the next slide. Perfect. So let's start talking about workforce. What does that really mean? And we always start our presentation with these core slides, and we do this for a very specific reason. Because, and again, I don't think that there's anything that all of you don't know, and I really like the variety of individuals that we have in today's presentation, is that you don't have a health center without a workforce. We talk about workforce being the fuel of your health center. So in order to keep that, in order to really help your health center function and provide for your clients and patients the services that they need and they deserve, you have to invest in your workforce. You have to look at it as an essential organizational issue and do appropriate investment in the operational and staffing resources that you have. We also see the workforce from the viewpoint of a few key features that we call our core components. And then, perfect. Thank you, Helen. So when we look at having a high functioning health center, we see these 8 areas as key things that you should think about, that really when you're working on your comprehensive workforce plan, you want to hit on in some way. And we will be talking about this one way or another throughout today's presentation. So everything from having that data-informed workforce plan, everything that you're putting forth, all your recruitment strategies, all your retention strategies, you need to look at the data. You need to see what's working. You need to assess. You want equitable and effective compensation structures. This is incredibly important, especially now with the workforce. So we're going to talk about, for example, in the advertising section, putting salary ranges, because a lot of people, if that's not in the job postings, they just won't even continue to look. You want a culture that is focused on engagement, a culture of wellness that is really focused in on what your workforce needs. Those tested retention and recruitment strategies, again, going back to data. Health professions training program. We won't talk too much about it, but we will hit on this. A chief workforce officer, what we really mean by this is just having an individual who has that strategic vision of what your workforce needs. Of course, you want high functioning managers, and then those policies that support diversity and cultural respect. So going To that JEDI, which I know someone had put in on what they would like to learn more about. And JEDI, just in case anyone may not know, it's justice, equity, diversity, and inclusion. So throughout, we will refer to it as JEDI. Next slide, please. And as I mentioned, this is also incredibly important because it is a HRSA focus. They are very strongly focused in on the workforce and advancing health center excellence. So as you can see on here, this is one of the key areas that they're looking at, and everything from strategic workforce management, recruitment, retention, employee development, and employee engagement. And we'll talk about these throughout today's presentation. Next slide, please. So let's get started talking about comprehensive workforce plans. So at the STAR Center, we created a definition for what a comprehensive workforce plan can be. This definition was vetted and approved by HRSA. And what you'll notice is we very specifically decided to leave it broad because each of you is going to do something different when it comes to your comprehensive workforce plan. You're going to know what works for your health center. So although we have these different components and we really focus in on these are key areas that you need to think about, they may not be the same health center to health center. So again, you need to know what your health center needs are in order to know what components make sense. Most of you too, to be honest, you probably have a lot of this content already, but it's not written down or it's not put into a comprehensive workforce plan. And that's really the key of what HRSA is looking for, that your PCAs will be working with you on development. And of course, here we are here to help if you have any questions. As I mentioned with the slides throughout our different resources, you will see that it says click here to download, and in the last slide we'll have all the resources. So we look at a comprehensive workforce plan. Again, it's assessing the needs of not just your workforce, but the patients, the community, and then how do you bring in that qualified personnel that embody that mission-driven, equitable, and inclusionary values, because that really should be the core of what your health centers were built upon. And for that reason, we always start with the vision. You need to know what you're looking at. What is your health center's vision? And that is different than the mission. This is the overarching large goal. And that helps you then move into those different areas. You want to assess where are the gaps, where are the strengths. In the assessment that we're going to talk about, we are going to look at it from a provider perspective, but this really should be looked at from all staff. Again, retention and recruitment. So as you can tell, before we even get to retention and recruitment, we need to assess. We need to see what our vision is. We also talk about retention before recruitment. You want to keep your workforce before you start recruiting people. And the people that you currently have in your workforce are really the best ambassadors for bringing in people. Once people are in, once you've recruited them, you need to develop them. And then for all of these components, you need to have an action plan that you're going to revisit and you're going to see how everything is going. So that again brings in that data component. Next slide, please. Okay, so as we're talking about comprehensive workforce plans, one of the things, and I think that there's been a lot of conversation around this, especially with the PCAs, and they most likely have talked to you about this, and this was another conversation that we had with HRSA. So I wanted to bring this up because I felt this was really important. So you have your comprehensive workforce plan. Now, for a while, there was also the conversation of the strategic workforce plan. That is specific for health professions, education, and training. And in a moment, we'll move to the other slide so you can see how everything fits together. But when you hear comprehensive workforce plan, when you hear strategic workforce plan, they're not the same thing. The comprehensive workforce plan are all of those components. All of those are overarching areas. And then the health professions, education, and training plan, again, recently referred to as the strategic workforce plan, it's one component of your comprehensive workforce plan. Helen, could we go to the next slide? So we put this diagram together. And again, I'm sort of stepping a little bit outside of this to really hone in on this area because we know that there was just a lot of conversation around this. So what you'll notice, all of those components of the comprehensive workforce plan are here. And then the subcategory in development is the HPET plan. And that's incredibly important because it goes back to that growing your own, having people train in your health center in order to develop them. And it is also a recruitment and retention strategy, but you really want to see it under that idea of developing your staff, bringing people in and growing your own. So you'll have both the overall comprehensive workforce plan, and then you'll have that subcategory, the strategic workforce plan or HPET plan, however you prefer to refer to it. Next slide, please. Okay. So there's a few reasons why the workforce plan is important, and these are just some of them. This doesn't encompass everything. But what is so important in writing it down and having some type of document where you can keep everything, it helps you track your successes, but it also helps you identify opportunities. So this is the area where you're looking at those gaps. And now more than ever, having gone through COVID, being in the middle of the great resignation, as people talk about that, seeing how much burnout, different mental health struggles have really increased in the workforce, the changing workforce, hybrid work schedules, what people are looking for, there is a lot that you can do to go into your comprehensive workforce plan and identify where those opportunities are for change. But there's also a lot that you're doing that is already successful that probably you have put into place during COVID-19 or even before that works really wonderful for your workforce. So again, this tracks that. It allows you to utilize that data to make the changes that you need. And ultimately, it also has to align with your goals. And we're going to talk a little bit later of why that alignment is so fundamentally important. Next slide, please. We also, once you have a workforce plan, so some of you may have a workforce plan, or you may have a part of a workforce plan, or you may not have a workforce plan at all. It's totally fine, depending on where you're starting, it doesn't matter. The importance is that you get started. But once you have it, we really, really recommend doing an annual review. Again, you have to look at what makes sense for your health center. But what I would say now more than ever, with how much the workforce landscape is changing, do a review, see where everything stands, and it's incredibly important. Again, identify your successes and identify your opportunities. Next slide, please. You also want to have certain key team members involved in the development of your comprehensive workforce plan. So we have a lot of people on the line today that work in HR, some that are newer, some who have worked in that position for a long time. So you really know the importance of having different individuals come together to formulate this, to look at recruitment and retention. So as it says here, individuals working in HR, if you have a chief workforce officer, someone in a similar role, any of your workforce or HR staff, but also you do want to bring in staff that has expertise in certain areas. So I know somebody had mentioned that they wanted to look at how to specifically recruit physicians. Talk to the physicians at your current health center. What are they looking for if they were being currently recruited? And do they know anyone who may be a great candidate and have interest in working at health centers? So the importance of bringing that staff when you're recruiting different people, for example, if you're recruiting a dental provider, bring one of the dentists that you already have on the team as part of that recruitment team. Have them help you, form your comprehensive workforce plan. And it is also really important when you're putting the comprehensive workforce plan, yes, you're looking at all your staff, you are looking at recruitment in a general way, but you also want to hone in on very specific areas. So dental providers, what are their specific needs? Behavioral health, what are their specific needs? Physicians, what are their specific needs? Those type of things, and that's where you want to bring in that expertise. Write it down, keep it there. This is also a way to have the historical documentation. So if someone else comes in to that role, it really helps you to know where things were and where things are going. I also, and I meant to mention this earlier in the introduction, if you're having any technical issues, Mariah Blake is your go-to person. So just contact her. Her email is also mblake@clinicians.org, and Mariah will be able to assist you. I just realized I didn't mean to skip over that. Next slide, please. So we do have a template, and one of the things that your PCA asked us was to really highlight the different resources that the STAR Center has that can help you build this. So we have a recruitment and retention template. That's the current name. But the truth is that this template allows you to modify everything that you need to modify, and at the end you create your comprehensive workforce plan. It falls under that. We are currently updating it to be released hopefully later in the spring, summer, and we did this because it was created in 2016. But what we also really wanted to look at was how to incorporate more JEDI components into that. What is the most up-to-date data that we can provide? And we have an instructions, we have a template, and we also have a separate action plan. Helen is going to be talking about the action plan, and you'll be seeing some of the pages that we have included on there. So the template, you can still 100% use it, but I also wanted to let all of you know that we are updating it, and it will be provided to everyone hopefully soon. Also, our goal is to translate a lot of our materials into Spanish. So that may take a little bit longer, but it's something that we really want to do. Again, that JEDI, that inclusion. Next slide, please.
I wanted to add really quickly, when you get the slides, each of these images is hyperlinked to each of those resources. So if you want to just quickly access them once you have the slides, this is a good way to find them.
Thank you, Helen. Yes, I had forgotten that part, so I really appreciate it. The template as it currently stands is divided into 3 sections, and they cannot really be separated from one or the other. As we're updating it, we're also adding more into the idea of what is the vision, how to develop that, and then also the development component and HPET work. So that will soon be added, and we're expanding that. But currently, we look at 3 main sections: assessment, retention, recruitment. As you see, they're all connected, but really we want you to start with assessment. We then want you to move into retention, and finally recruitment. You can't know what you need and where you're going without properly assessing where everything currently is in your health center. Again, retention is so important, and not that recruitment isn't, but once you have people, you want to be able to keep them. So what are their needs? What are they looking for? And the way that we're looking at this is really from that changing workforce landscape. Sometimes it also creates a lot of dialogue, because it does mean some fundamental changes that may not have been there before. So again, as I say, if you have any comments on any of this, go ahead, put it in the chat. And then finally, we're gonna end with the recruitment section. And what does that mean? We have essentially a step ladder of the different components that you need to hopefully and effectively recruit those mission-driven providers. Next slide, please. So we have a few more Menti slides, and I believe, Helen, is it 3 of them back to back? I just want to make sure. Yes. So I want you to answer these questions, because it's important to think about this. Now, some of you in your role, you may not know, and that is totally fine. But what you're learning here is going to help you to help that recruitment team, that HR team. So we're going to ask, has your organization created a comprehensive workforce plan? Again, it's okay if you have not. What's important is that you're working on doing that. The next question we're going to ask, Helen, do you mind just going to the next slide? Is if you answered yes, have you updated it? And when have you done that? Because again, you may not know, and that's okay, but it's incredibly important, especially now more than ever, that you're updating this, or if you're putting it together in your action plan, you're already writing down, when are we going to review this? And then the last question we're going to ask is, what is your greatest challenge either in creating or updating the comprehensive workforce plan? Because there are challenges. You know, things in workforce are changing really, really quickly. So Helen, if you want to stop sharing, and I will jump back to the Mentimeter. So right now, you should be seeing the first question, has your organization created a workforce plan? So let me share my screen. Okay, so we have one response as a no. Again, totally fine. This is what we're here for. You know, we're going to lay out what should be in there, what hopefully you can work on. And then we'll go to the other questions. So unsure. And that's what I figured too. You know, many times we just don't know. And what happens is we also have a lot of these components that all it takes is just putting them together. So we have another no. I don't see any yeses. I'll give it just a few more seconds. Unsure. Okay, just for timing, I want to make sure to go to our next question. And again, this is part of that assessment. You need to know what you have and what you don't have. So actually I realized nobody answered yes. Usually sometimes that happens, and that's totally fine. So, you know, if you answered yes, we were going to ask how often you updated it, but you know, because nobody did, I'm going to go ahead and skip this slide. Again, this goes back to, you really should do it on a yearly basis, probably even sooner, as things are changing very rapidly. And then what is your greatest challenge? And as you can see, we said updating, but since nobody said yes, what is your greatest challenge in creating that comprehensive workforce plan? And just to kind of give everyone some information, what we usually hear is time, limited staff, and then also the need for a template or something where we can just, finding time to create it. That's what I figured. That's what that is definitely most of what we heard. And the thing is, you don't necessarily have to set aside specific time for creating it. As you're working in retention, as you're working in recruitment, write those things down and put it into some type of document. That's already a way to get started in your comprehensive workforce plan. Or what you have is your policies for recruitment and retention, your vision, your mission, all of that already should be written down in some way. So just, again, start putting it together in a document. We've had a lot of transitions in the HR department. So this is another big thing that we've heard, as with the Great Resignation with many people. A lot of people in HR are leaving. And one of the things that I want to say, because we do have a lot of the HR folks here on the call today, is that experience with burnout is so heightened right now in HR departments. So a lot of people are realizing and are leaving these roles because simply they're burned out. There's so much that has been put on their plate. So it is understandable. And again, when we talk about how to take care of your workforce, we really mean everybody, including yourselves. I have ideas, but not enough time. Absolutely. And again, it doesn't have to be anything that is so super formal. If you can write down and really just start tracking, that is a key thing. And what we hope is our template is also a way to help you. Okay, so let me stop sharing and we'll get back to the retention and recruitment plan, or the comprehensive workforce plan. So as I said, in our template, we have those 3 areas that very much follow the definition of a comprehensive workforce plan. One of those key areas that we start is with the assessment. So our R&R template, those are linked throughout this presentation, but we look at different areas. And as you notice, a lot of this is very much provider focused. As we update it, again, we want to look at the whole staff, the whole team, but assessing where do providers currently stand? What is their capacity? What is the satisfaction that they have? What is the mix of those provider to care to the rest of the care team? What is the appointment access that your patients have? You want to look at the non-provider support staff as well, patient schedules, how that impacts providers, and the succession planning. And again, as you look at all these, yes, they're provider focused, but you really should also be assessing other staff in your health center, because as you notice, there's a lot of turnaround, for example, with HR. And a big part of it is that focus on their wellness was also not there. So we want to focus on providers, but it's important to focus on the whole of your health center, because all staff need to be taken care of. So all of these key areas are in our template. This is really a starting point for your operational assessment. Another thing that we've talked a lot about, if you notice here, there's a lot of focus on the productivity component, but we also want to look at assessing just the quality of care that is being provided and how much demand is really being put on staff, and what is realistic to keep people and what is just too much. Next slide, please. And of course, being able to have the support for people that they need. So, and then let me just get out of the full screen. This assessment of your operations is one of those first steps of having in your comprehensive workforce plan. I will say, not having one before, this may be the one that takes the most time, because you probably already have a process for your recruitment. You probably already have some retention strategies. So this one is going into how can we assess where our operations currently are. And this is where you want to start filling in those gaps, probably focusing in more on the retention component to be able to fill in those gaps for the assessment. But it also goes into recruitment, the way that you're going to promote yourself. When people come in and you're interviewing them, they're also interviewing you just as much. So you want to be able to talk about how your health center is structured and how providers are working and how other staff are as well. Next slide, please. So we're going to go into retention. We really wanted to provide as much information as possible in these 2 hours, but I wanted to ask, does anybody have any questions from what we've talked about already? I'll give it a few seconds. And I believe people can also unmute themselves, if I'm not mistaken. Mariah, is that correct? Sorry, I'm calling you out in the middle of the presentation.
No worries. Yeah, folks should be able to unmute themselves. If you have any trouble with that, either raise your hand in the Zoom controls or let me know in chat.
Perfect. Thank you, Mariah. Okay, so let's talk about retention. We look at 5 core areas when we talk about retention, but retention can be so much more than that. But these are things that especially the current workforce, but really the workforce always has been looking at. So let's get started. Next slide, please. Perfect. mission. As I said, well, first of all, sometimes we don't even know the mission of our health center. So one of the baseline things, and this is a one-time presentation, but I would say go back and read the mission of your health center. And it's really important that the mission is kept up to date with what's going on in the world and what are your organizational values. When we look at the mission, oftentimes we think about this is the focus on how we're going to work with our clients, with our patients. But what you have in your mission, your organizational values, need to also be reflected internally. That disconnect between having great patient care, a great focus on the patient population, on the community, but not reflecting that in the way that you take care of your workforce, that disconnect is one of the key things for why people leave. So leadership really needs to reflect those values in their day-to-day actions. And now it's never going to be perfect, and that is a reality, but being transparent, talking to your workforce, that is very, very important, and having them understand that what you value as a health center also means in how you value them. And you have to align that mission with what the beliefs and values are also of the workforce. That is very, very critical. So for example, things like JEDI, that's incredibly important that that is reflected in how you're treating your workforce. Equitable compensation, there's a lot of conversation around this. All of these are critically important for people to feel I'm a mission-driven person. I want to work in a health center, and I want to make sure that that mission-driven mind is also what leadership is doing, what my managers are doing, and what we're able to offer our patient population. Next slide, please. So as I said, compensation has to be equitable and effective. Now, when you're assessing this is an incredibly important part of your assessment. Assess where you currently stand on compensation. Look at, what is the market value across where you live or where you're located. So it also has to be sustainable, but you have to line it up and average it out with it being competitive. Now, a lot of health centers will say we can't be competitive in the same way as hospitals and things like that. And we completely understand. But using that language is really not effective when you're trying to recruit people. And this is why we also say having really effective benefits, having a culture that people want to work there will make a difference in sort of meeting that gap between having a sustainable compensation as a health center and one that is still equitable and effective at baseline. And if you could go to the next slide. You want to ensure that it's lined up not just with a living wage, but also a thriving wage, regardless of who your staff are. Nobody should come into work and still be worried about their housing, their food. Now, that is also a very personal thing. You may not know the financial situation of someone outside of the health center, but at the very least, try to line it up as much as you can with the competitive market. Also, we've heard a lot of, especially individuals in leadership positions say, well, that mission-driven part is not there anymore. People are just focused on the money. That's okay. That doesn't mean that they're not mission-driven. It just means that they understand their value. And that is an incredibly important thing to also take into account. Your benefits. All of you have benefits, but does your staff even know what they are? And when you're looking at the benefits, are you looking at it from a very broad perspective? So bereavement leave, we usually think, mother, father, spouse, children, but in different cultures, the way the family is looked at is very broad. So, look at it from person to person. Do you have maternal and paternal leave? Is it paid leave? Do you have a floating holiday for people that don't follow the regular holiday schedule? They have different cultural beliefs, different religions. The benefits, does it also include partners and families? Is your health plan inclusive? All of you are in healthcare. If you're a health center that's focused on transgender care, is that also reflected in your health plan? So again, go back to the assessment, look at what is really in your benefits plan, make sure you're communicating it to your staff, and in fact, put it into what you're advertising for people. Next slide, please. Work schedules. This is incredibly important. People want flexible work schedules now. Now, we understand in healthcare, this may not be as flexible as maybe in some other industries, but there are health centers that are looking at going to 4 days a week to ensure that their staff feel that they have a 3-day weekend rather than, having to be in the health center 5 days a week. There's a lot more that are using telehealth. For those that are not providers, can they work from home? And are you able to talk to each of your staff so that they are able to tell you what are their needs when it comes to this? And a lot of people, because we're working from home, said, well, clearly this showed it can be done. And if we're going to be going back into the office, they want leadership to explain to them why. And that's very, very important. Next slide, please. Career paths, that is fundamental. This goes into that professional growth and advancement. Everyone who comes in to any job, you want to know that you're not going to be just stuck in your position. So we hear a lot about the difficulty of recruiting MAs and DAs. The health centers that have been the most successful have set up training programs for these individuals, but also supporting in one way or another. If someone comes in as a medical assistant and their ultimate goal is to be a nurse, a physician, a social worker, all of these different roles, how can you support them through that schooling? And I'm not saying just financially or that you have to financially support, but you've already trained someone in your health center of understanding that they're going to leave for some time, go to school, and then recruit them back. They already know the health center and they already know the mission. So the more that you support your staff in that advancement is incredibly important. Oftentimes, behavioral health providers, we never think about them for leadership roles. And they are great. They don't always want to be in the position of doing therapy. They want to take that next step. And if they feel like they've hit a ceiling, that's when people say, okay, it's time for me to go somewhere else. And everything that I'm talking about, these are the things as you're creating these policies and these programs, you want to write them down. And that's where you're actively, as you're working on this, creating your comprehensive workforce plan. Next slide, please. So those were the key retention areas. So again, ensuring your mission lines up. Write down your mission. Make sure that that's probably the starting point of your comprehensive workforce plan along with your vision. You want to have equitable compensation, benefits that people know what they are, and also ask your staff if those benefits are working for them, because it takes a lot of money to invest in these things. And if there's things that staff are not using and it's not helpful for them, it's totally fine. Again, the career paths, people want to know that they can advance. These are all fundamentally important things. And all of those things that we talk about in the retention plays into the recruitment component, especially as you're advertising. You want to put these things in your advertising as you're interviewing people. Let them know the type of place that they're going to come in and work. And as I said, we have this recruitment ladder, and everything builds upon itself. So this is where you want to really take a step back, look at these different components and how they impact each other. Next slide, please. So we're going to start with the community. As I mentioned, you want to see what's currently going on where your health center is located. There's a lot of changes that are taking place. What is the average compensation? What is the cost of living? All of these different things. What are different planning initiatives? Is there a new hospital opening up? Is there a way that to collaborate with them? What are different partnerships? So one of them would be the PCA, but there's a lot of other nonprofits, schools, those type of things. So when you start recruitment, look externally before you go in and look internally, because this is going to give you essentially a lay of the land of where everything stands and how competitive the market is, so that you then know what you need to say and what you need to do to recruit people into your health center. And this includes physicians. You know, it's incredibly important of looking at, you know, why are physicians coming to work here? Why do they want to be in our health center? And how can we recruit those mission-driven providers? You know, going to the local schools, starting early from high school, even before that, of getting people in that track of wanting to work in their community, wanting to work for the mission of your health center. Next slide, please. So you've looked externally, you've looked at what is going on. You've already seen what we have internally in our health center. What are the retention that we're doing? You know, you've done a lot of assessment at this point, and this is where you start to build your recruitment team. Now, again, we completely understand there is a big void in HR at the moment. So this is why we also talk about including other staff. So there was one health center that has their behavior health director in every single one of the interviews because that's their specialty. It's learning the language, the nonverbal language of people, how to talk to people, and it really was incredibly helpful for them. However you decide at your health center to build your recruitment team, write it down, write what each of the roles and responsibilities are for people. Again, that gives you that historical knowledge of where things were. What are their abilities, their skills, and be able to act quickly and ensure that it has a DEI lens. So for a smooth process, we just have it here, and I think it has an animation where it's the right people, it does. The right people, the right place, and buy-in. Leadership needs to have buy-in for your workforce. And we're going to talk about that as well, because turnover is incredibly expensive and it's going to cost you so much more than investing in your recruitment team and in your recruitment strategies, the retention ones as well. Next slide, please. So what are your priorities? Again, you want to think through, not just be reactive, but proactive. And that's what your comprehensive workforce plan is doing, is helping you be proactive. And again, you don't have to set aside specific time for this, but build it as you're working on these things. There's a new positioning, you know, you're at your health center, you have a new positioning open up, you're looking for a family medicine provider. Well, what are the priorities for that position? What are you looking at when you're bringing in people? What is that big picture? That's why I said, know your mission, know your vision. Know how your health center currently stands in JEDI. That is incredibly essential because it helps you go to different places to recruit for these individuals. And again, we'll also talk about that later. Your strategic plan. Now, this is not the strategic workforce plan. This is not the HPET plan that we talked about. This is your organizational strategic plan that has your goals, where you're looking at everything, you're looking at workforce, and it helps you identify what are the open positions, what are the soon to be open positions. This is part of the assessment, knowing who may be retiring soon. You know, what is the succession planning that you're doing? Have realistic timelines. Right now, it is much harder to recruit people, and that is the reality. A lot of people have decided, you know, healthcare is not for them. This is not the place where they want to go. So how do you find the people that know that this is what they want to do? And that's what we'll talk a little bit more about. But you have to make that a priority. And as new information becomes available, make those priorities. COVID-19, again, really created the focus in on having hybrid workplaces, having telehealth. So make those priorities as you're building your recruitment policies. Next slide, please. And as I said, recruitment is expensive. You have to budget and you have to plan. Again, you want to be proactive, not reactive. You do have to invest in this, and leadership, it's incredibly important to understand why investment in this matters. Again, going back, you don't have a workforce, you don't have a health center, but turnover is going to be so much more expensive, and getting actually the breakdown of numbers of how much turnover is costing you is a great way to build that buy-in from leadership as you're putting together your recruitment budget. Next slide, please. Some of you may use recruiting firms. This is not for everyone. Some people find them helpful. Other people find them as, it's an expensive endeavor, but we're not really getting what we need. But if you do use them, just make sure to check referrals. Again, just create a simple table that says we're using this recruitment firm. This is the experience we had, good, bad. Again, for someone else to come in to know, and for future individuals in HR to be able to have that document, that log of the different ratings, and also ask for discounts, because as health centers, as nonprofits, you may be able to get a discount from a recruitment firm, sometimes up to even 50%. I know that nonprofit rates and different organizations can go like that. So ask, because you may not know, and write it down next to those ratings that you do, that these recruitment firms are offering discounts. Next slide, please. Okay, so actually I didn't realize we're about to get into advertising, and I feel like advertising, interviewing, everything that we talked about, this is now when you want to write it down and when you want to promote yourself, brand yourself. So we're going to do a 10-minute break. And actually, I know we started just a few minutes late, so I'm going to have you instead come back in, what do you think, Helen? Should we do 5 minutes instead, or are you good with 10?
I'm good with 10, or even let's say 9, since it's
9, okay.
1:31.
Yes.
Say, come back at the 40.
Yes, at 1:40, if everybody could be back. And while you're on the break, if you do have any questions, just feel free to put them in the chat.
See you in a few minutes.
Okay, welcome back, everyone. So it is 1:40, and I know everybody's on the East Coast, but actually Helen is over in Colorado. And I just wanted to make just sort of before I pass it on to her, I know that we'll be talking a lot about how things are changing and how you can really do a lot of this in a different way. And also just life is way more expensive right now. There's so many things going on. And we understand that this may not be something that every health center can do, but the more, especially as leaders, that you can be transparent with your staff, that you can talk to them about how you're making changes to ensure that, their wellness is focused in on that, what their needs are. So again, having formal conversations with your staff, ask them what they need, promote that. And again, you start with that retention in order to then put that out for your recruitment. And part of what the assessment does is that it really helps you see, what's working, what's not working, what can we cut out to really invest in what we need now. So I'm going to pass it on to Helen.
Great. Thank you so much, Michelle. And thank you for that reminder. I think that, like you're saying, that's so important over the last 2 years, specifically with the pandemic and with a lot of social justice movements that have happened. A lot has come to light, and the workforce and their needs have changed, and employers need to meet that change. So it's a good reminder. So continuing on in terms of recruitment, we're going to talk about advertising now. So it's important to develop a broad advertising strategy focused on your local, state, and national sources. It's important to plan and track all of your advertising, just like with everything else we've mentioned. We love planning and tracking, so we encourage that for advertising as well. And then leverage your partnerships as you're able to. The instructions for the R&R plan template include information on how to write those compelling ads. That's another piece of TA that we often offer, not necessarily all the time, but if you want to run an ad by us after this training, feel free to reach out, and we can help give you some pointers on ways to maybe zhuzh it up. It's important to mention the mission, as Michelle has been talking about. We want those mission-driven folks. And so you want them to know not just, oh, generally it's a nonprofit that does healthcare, but what is your specific mission, and do they align with that, with those sentiments? Explain who your patient population is. That's important. Use positive language when describing your health center and its staff, its patients, and its community. Michelle kind of mentioned this, that we hear so often the health centers say, oh, we can't be competitive. But you don't A, you don't need to say that. B, that's not necessarily true when you're factoring in all these other elements like culture, benefits, etc. And so shifting that language to the positive, and you're showing off, to show off that your organization is a good place to work. And that goes into this next piece of answer the question of why your health center values its community, values its patient populations, and why you would be a good place to work for folks. And show, like Michelle has been saying, show that your health center cares about its workforce, cares about every staff member, and understands the impact that everyone has on that mission. It's really important to recruit strengths-based practitioners and avoid that language that connotes a burnout environment, like fast-paced, under pressure. We can say that we're busy and that we serve a lot of people without connoting that this is a place that's going to burn you out, and without being a place that's going to burn you out. We also encourage avoiding gendered language, and some of this is really coded. There's actually a gender decoder tool that I can put in the chat later that can help you run through your ad and see if there's sort of language that traditionally has been used to describe male or female, stereotypical behavior. And then we, like Michelle mentioned earlier, we are so clear in that you should include a salary range. It is a way of the past to not include a salary range. That's important. It'll save you time with candidates who wouldn't have applied if they knew the salary range, and it'll help increase that pay equity. Transparency is part of creating pay equity and helping people understand what others are being paid, what the growth opportunities are within an organization. It's just really key. And I will say, Michelle and I are both millennials. We've both been in the workforce for about 15 years, if not more now. And I'm not applying for jobs, obviously now. I'm very happy at ACU, but I don't apply to jobs that don't have a salary range because I don't know if it's going to be worth my time. So that's something that we really want to make clear. And then make it personal. Make your advertisement appealing and personal. You can be creative. And then, of course, using a user-friendly application process. I can't tell you how many folks have you send in a resume and then also put everything that's on your resume in each little section. You want it to be easy to apply. You want it to be open and feel like someone is communicating with a person, even if you are using some kind of algorithm to at least sort through on that first step. You want to make sure that it feels like people are, talking to a person. So those are some key things for advertising. We also, just like with everything, taking in that Jedi lens, it's important to be inclusive with your advertisements. We encourage folks to develop an organizational DEI statement or commitment. This is an example from Central City Concern, which is a health center in Portland, Oregon, that serves people experiencing homelessness. And then highlight those inclusive benefits. If you have a mentorship programs for BIPOC folks or other underrepresented staff or people from historically and systemically marginalized communities, talk about any needs accommodations that you know that you're going to be willing to have. And then, like Michelle was talking about with those benefits, include those inclusive leave policies or other benefits that you have to, again, help show the people who are applying that you care about your staff's well-being and that you're going to be a place that if they come to work, they'll be happy. And thank you, Michelle, for putting that in. BIPOC stands for Black, Indigenous, and People of Color. So thank you for that. So again, in terms of this DEI lens, we want to highlight different places that you can post to try to really be recruiting folks from those systemically and historically marginalized groups: the National Hispanic Medical Association, National Black Nurses Association, National Association of Hispanic Nurses, National Medical Association, and of course, the ACU Professional Network is a great place to post. We do have this resource that is linked here. It's Building an Inclusive Organization Toolkit, and within it, there are lots of different resources to click through. I believe I hyperlinked this specific resource within. So this won't lead you just to the Building an Inclusive Organization Toolkit, but to this resource within it that has a list and links to specific places that you can post to be recruiting folks from different backgrounds. So of course, social media can't be avoided. Sometimes we wish it could, but tis the season of our lives of social media for the last 20 years. So it's important you should already be using social media as a health center. So if you're not, maybe talk to a marketing team or other folks to get that started. But if you already have social media, which again, most health centers do, leverage what you already have and go from there. It is, again, so important to keep track of whether your social media is working as a way to reach potential hires. Track and assess, always, always. We encourage folks to start small, think just like LinkedIn, Facebook, and Twitter. We don't recommend things like TikTok, know your social media and know where the people who you want to be hiring are going to be looking for employment opportunities. I tend to mention that for me, I don't look for jobs on social media except LinkedIn. And I think that this is another generational thing. It's really important for the generation and the group that I come from to have that work-life balance. And we even apply that in our use of social media. So I sort of think of things like Instagram as my fun social media and LinkedIn as my professional social media. And I would rarely apply to a job that I saw on Instagram, but that's just me. And, so do that tracking, see if your Instagram posts are getting clicks through to your website for job posting, et cetera. It's different across geography and community. So if you track those things, then you can know what's working for your health center. And then of course, like with so many things, it's important to leverage your current staff. So if you have a job posting that you put on LinkedIn, feel free to ask your staff if they're comfortable. Hey, will you repost this on LinkedIn so that your network sees it? And all those kinds of things can really work. Same with Facebook, wherever you're posting on social media and wherever your staff are comfortable reposting on social media, that's important. And as Michelle put in the chat, we also see idealist.org is a great way to look for mission-driven staff, totally thinking about not just social media, but what websites you're posting on. And, maybe Craigslist doesn't get the most mission-driven or driven in general folks. Maybe it does in your community. Again, every community is different, but idealist.org is a specific website that posts mostly political and nonprofit positions. So again, as a mission-driven person, that's where I look if and when I'm looking for a new position. That's some background on social media. So now we're going to talk about interviews, and their interviews are a multi-process thing. So interviews are going to be the next several slides. It's important to have a screening process, of course, and use or track your results. There is an Excel document candidate tracking sheet within the R&R plan template and instructions. So we have already created, just an easy, it's nothing complicated, but it's a nice Excel doc where you can just track what's going on. It's critical, of course, to respond quickly, communicate often, and ensure that rapid turnaround of questions, interviews, and site visits if you're doing a site visit. And it's the tool that I mentioned tracks folks through the entire recruitment process, including that site visit piece. So again, once you receive a CV or a resume of a candidate, contact folks as soon as possible. Don't let the good ones get away. Often if someone is applying to work for you, they're applying elsewhere too. And so if they're a good candidate, you want to be the person who responded quickest, seemed the most interested, seemed the most engaged, so that they want to work with you, and then, let someone else be the organization that this great candidate got lost in their inbox. Don't let that be you. So the next step would be phone interviews. It's important, of course, to prepare your content ahead of time. You want to have that overview of your health center, just like we talked about for writing your job postings and advertisements. You want to make sure that you're telling a story about the place that this candidate could potentially work. And then you want them to have a good understanding of who they will be working for and with, and the community they would be serving and would be a part of. Of course, that's if you're recruiting from outside your community, but even if you're recruiting inside your community, not everyone knows, who the health center serves and how it fits into this larger community. You want to make sure, of course, to ask your questions of the candidate and offer them next steps of what will be happening next. During the phone interview, like I said, you want to describe the health center, outline that position, ask those questions, allow time for them to ask questions, and then listen deeply. Make sure that you're really hearing what they're saying, reading between the lines, and again, offering information that can help them make a decision as well. And then, like I said, make sure that you say thank you and that you offer them the next steps for what will be coming down the pike. So then after the phone interview, or during, you want to be recording the responses, presenting the results to your recruitment team, seeing if there's any additional questions that you want to follow up with, either in an in-person interview or a Zoom interview, depending on how you're doing things, or just another phone call, or is there something you missed that you just want to make sure you follow up on. Then talk about with the team if, given the information you have so far, the candidate is a good fit, and then schedule that on-site interview or Zoom interview, depending on how you're doing things. And then again, just bringing in that JEDI lens, we want to make sure that we're being intentional about JEDI as we're conducting our interview. So review applications with that diversity and inclusion in mind. Where possible, exclude information that could lead to bias. So, there are studies that show that stereotypically Black names on the exact same resume as someone with a stereotypically white name receive fewer callbacks. So, and that's just part of implicit bias. And so one of the things that we can do to combat implicit bias isn't to beat ourselves up about it, but is to remove the source of that bias. So, removing names and just seeing candidate qualifications as your first steps. Obviously, at some point, you're going to need the team to know candidate names, but as you're first reviewing folks, removing these sources of bias. And then, of course, beyond name, be aware of the subtle and unintended bias when reviewing CVs, like educational institutions, locations of prior employment, type of experience, their gender, etc. And then again, like there are things that we have implicit biases about that we can all work towards eliminating those. But a first step is just to be aware and try to, counterbalance that as we're reviewing applications. Identify a list of core questions that you want to ask of all candidates. The questions should be related to the job and the job description, and ensure the search committee is aware of any illegal questions, of course. And the interview process should be as close to the same for all candidates as possible. And then, of course, consider that cultural difference can affect first impressions of candidates. For instance, the standard interview in the United States uses the criteria of self-confidence, goal orientation, enthusiasm, and leadership, even though these qualities may not be apparent in people from more reserved cultures. They might still be there, and having a diversity of cultures and a diversity of different ways of approaching confidence and leadership can be really beneficial to your organization. And then, of course, reserve ample time for interviews and for evaluations as bias emerges more when evaluators are limited by time pressure. And then establish a diverse hiring committee. Those committee members should demonstrate an understanding of DEI principles. And if you need to, you should invite external partners to be part of that committee to help increase the diversity of folks who are reviewing your applicants. We also wanted to include some questions to include in an interview for that JEDI lens, especially since health centers work with diverse populations from systemically and historically marginalized groups. We think it's really important that we're asking these questions of our candidates to make sure, again, not only that there's that mission alignment, but there's that value alignment and core understanding alignment. And it's not to say that if someone doesn't have, you know, a strong DEI background, they shouldn't work at a health center, but it can help you understand, you know, where that person's going to be when and if they start at your organization, and what kind of training would be appropriate in that area. It's important also to look for, when thinking about these questions, did the candidate address different aspects of diversity beyond race and gender? Did they think about disability, religion, etc.? Do they have a clear understanding of what equity and inclusion means, and do they appear to champion those values? And again, this is really important as health centers, and that we come out of the social justice movement, and that we have that privilege to come from this long-standing civil and social justice movements, that to honor that, we should carry that legacy forward. So then the next step in your interviews is this on-site visit or on-site interview. It's important to plan ahead the logistics, the visit, a partner itinerary if they're bringing a partner, and a joint itinerary again if they're bringing a partner. Think about who you want to be involved in this process, who from the health center will partake, and what will their roles be. And beyond that, are there community members you'd like to include? Patients, maybe someone from your board of directors, leaders in your community, real estate agents, if someone's coming from outside your community and will be needing housing and needs to figure that out. And these folks can help give a candidate a warm welcome and make the idea of working for you and working in your community really appealing. Of course, this is more, like I said, if you're bringing in a clinical provider from outside the community, and it's great to hire as much as possible from within your community. And you know what's best for your health center. This stuff is expensive, but like Michelle said, turnover is more expensive. Of course, you're budgeting for this, like Michelle said too, it has to be sustainable. So think about what you're going to do and what you can provide for an on-site interview that will really be sustainable and help you create that nice pathway in for those who you're recruiting. Of course, with logistics, you want to think about travel, car, hotel, meals, the address of the health center, of course. For their visit, you want to think about any tours you want to give, the folks that you want them to meet with, support staff, providers, CEOs, CMOs, etc. If they are bringing a partner, think about if they need, you know, if they have a family, do they need to see schools? Do they need to think about childcare, those realtors, etc.? Potential employers for the partner, if that makes sense. And then think about a joint itinerary. So a dinner or meeting with key staff for everyone, dinner meeting with other providers, or if there's a cultural or unique community event when you're having this on-site interview, include both people in that. And then we also know that COVID has changed a lot of this, and that not every person who's going to come to your health center, you can do, you know, a big visit, multi-day thing. So think about if you're doing a virtual on-site interview, think of it as the same way you would an in-person one. Bring in different people so that they can virtually meet different folks, go on a virtual tour of your health center, you know, put on a GoPro and link it up and take them around the health center. Think about how you can be welcoming to a candidate's family in a virtual setting. And this is really an opportunity to get creative, which I always think is exciting. So then next, you're going to want to be following up with the candidate or candidates in this interview. So you want to have developed a plan already. Think about the frequency, how often you're going to follow up with them, the timeline, what type of contact, is it going to be over email, is it going to be a call, how do you develop the texting relationship, and who's responsible for each piece. And it's really important to have all of this planned out and really clear, so that, again, that nothing, you know, falls out of focus or isn't followed up on. When you have a good candidate and they're interested and you're interested, you want to make sure that things move along and you have a plan and you're really communicating clearly with them. So next we want to talk about developing contracts. And we know that not every health center does contracts, just like with recruiting firms. It works for some folks and it doesn't work for other folks, and that's totally fine. But we also know that some folks do, and so we want to make sure that we at least touch on it. So to that end, the things that you should include in your contract are listed here. Work expectations, including clinical hours, administrative hours, and on-call hours, behavior, office sites and location, and a call schedule. Of course, that compensation and benefits should be spelled out clearly, professional development, expenses, moving allowances, and a termination clause. And clear expectations really make for the best experience for the largest swath of people. So this means that folks in both parties can go into an arrangement with their eyes wide open. So when your provider or new staff member comes on board, they really have a full understanding about what's going to happen during their time at your organization. And the R&R plan template does include a section on contracting. So of course, take a look at that. And there are specific things you should keep in mind and really make sure to ask about, but that also varies by state and by community. So the R&R plan has a list, but make sure you're also in line with your state laws and recommendations. All that said, it is something you need to think about to ensure that your new hires have everything they need worked out by the time they start. So next I want to talk about orientation or onboarding, which we want to be clear is not the same as orientation. For new hires, orientation is a one-time event welcoming them to your company, whereas onboarding is a series of events that includes orientation. And that helps onboarding helps folks understand how to be successful in their role and how their work contributes to the overall mission of your organization. So we just want to be really clear that it's not this one-off thing. It's an ongoing process. And so it's this crucial step in integrating new hires into your organizational culture. It allows you to set the new hire up for success, and in turn, of course, you set yourself up as an organization for success. And it's important to, like I said, remember that it's this ongoing process of integrating folks into your team. When I say integrating, I want to be really clear that I don't mean assimilating. It is like diversity of staff and of backgrounds and approaches is so valuable. And so we want to make sure that our onboarding and integration processes don't lean towards assimilation, but instead lean towards bringing this person who you have hired because they have value and are going to make your team better, integrating them into the group and helping them know and helping the group know that you value them and their input and their background and what they're going to bring to the team. And the end result of this process should be having someone really fully part of your health center's culture and having them be contributing to your culture, of course, as well. And we also, we want to mention, especially if folks are coming from outside your community, that it's about onboarding them into more than just your organization, but into the community as a whole too. So think about if there's community members or connections they should be introduced to, and how can you help them really, grow into this role and grow into this community. And why is it important to onboard someone? This says provider onboarding, but this is true for all staff. It integrates the new employee into the organization. It sets those clear expectations. Productivity occurs more quickly, and it reduces turnover. And as we've talked about, reducing turnover is the name of the game. So some other recruitment strategies to consider are, if you're a patient-centered medical home or becoming a PCMH, that can really help. Again, just as a it's not quick to become a PCMH, but once you are one, it's a quick way of showing people what kind of organization you are. Think about team-based care and how you're implementing that, and then also how you're advertising that that's what your health center engages in. Think about National Health Service Corps. Like Michelle said, the ACU is started by alumni of the National Health Service Corps, so we really love NHSC and all that it offers. So there's scholarships, there's loan repayments. It's a great opportunity. Many states have state loan repayments. Thinking about that health professions education and training, the connections you can have there. Think about residency programs, training programs, field placements, internships, externships. These are all other opportunities to increase that recruitment. And then this sort of, so thinking about a development strategy is really important, and it is a large topic. And then within that, there are different kinds of ways. So there's, like Michelle sort of mentioned, career ladders. There's also health professions education training. And then there's also, just supporting folks getting their CEUs, providing opportunities for that, providing that professional development, providing mentorships, etc. And within this, again, applying that JEDI lens, ensure that these kind of offerings take into account the needs of BIPOC individuals and other underrepresented or systemically marginalized folks. We also encourage people to remember that experience is just as important as education. I have a master's degree, so I don't want to knock higher education, but I also know that folks who've been at this work for a lot longer than I have a lot of wisdom, and that higher degree doesn't weigh more than a lot of experience and a lot of wisdom, both from work experience and from life experience, of both from an identity background and just time on this planet. Both are important. And then, like I mentioned earlier, developing those career ladders that lead to successful and equitable achievement in leadership positions, thinking about making sure that you have those pathways for folks from all different kinds of disciplines, all different kinds of backgrounds, identities, racial and ethnic backgrounds, etc. And you want this to be something that invests in your workforce. And again, that will show, as Michelle has talked about, that will really show that you value your workforce enough to help them grow as people and as employees. So next, I want to talk about action planning. But before I get into this, I don't see anything in the chat, but I just want to encourage folks to ask any questions or start popping them in. I'm going to try to get through this action planning section in about 10 minutes, and then we'll leave about 10 minutes for questions and wrap up. But want to encourage folks to be putting those questions in now so that we can just get to them as soon as I'm done. So action planning is an approach rather than a specific method, which helps focus ideas and decide what steps you need to take to achieve your particular goals. It's a statement of what you want to achieve over a given period of time, and preparing an action plan is a good way to help reach these objectives. And an effective action plan should give a definite timetable and it should set these clearly defined steps. And for each objective, there should be a separate action plan detailing how that objective will be achieved. And I know that seems like a lot, but it ends up being really helpful. And once you've action planned once or twice, it becomes a really quick process. And then having things separate by objective is really nice. So the steps are that you want to define your problem or your problems, collect and analyze the data, clarify and prioritize those problems, write that goal statement for each solution, implement your solutions, that's the action plan, and monitor and evaluate, and then restart with a new problem or refine the old problem. So that of course is a lot of information about action planning as a process, which is really important to know, but what is an action plan? An action plan is basically just your documented strategy for solving a problem. That's what it is, put simply. An action plan can also be known as a statement of work or a study plan, and at the very basic, the action plan is the documentation of what tasks will be done, by whom, and when. And we can't drive that home enough. This when piece, the timing, is really critical. And the action plan helps you manage the project and maintain focus on your goal. So I know you've seen this slide before. Again, this is the instructions, the template, and the action plan. I'm gonna sneeze relatively soon, so if I go off camera for a minute, that's what's happening. But also now that I've said that, that probably won't happen. Of course, see, yeah, now it's gone. You're not on your own in this. The STAR Center has tools to help. That's what we're here for. So like we've talked about, in addition to the instructions and the template, there's this companion retention and recruitment action plan worksheet. And who doesn't love a good worksheet? So each major item in the template is included in the action plan. So you can come up with the how, the whom, and the when for each piece of the retention and recruitment template. The action plan is this tool to assist in quality improvement efforts and help with your retention and recruitment. And again, I believe this slide, they're all clickable, so that's nice. So the action plan for the R&R plan template is to document identified gaps or barriers and opportunities, identify strategies for improvement, and create a timeline for completion. And like I've said already, this last one is huge. Creating a timeline for completion is so important. If you're anything like me, this one is so crucial to have a deadline for accomplishing certain things, and it can really keep you and your whole team on track. So again, you've already seen this slide, or no, you've seen a slide that looks a lot like this, but it is different. So the workforce action plan should be measurable. We all need benchmarks and goals to accomplish things that to know that we're succeeding and making progress on things. So this action plan will incorporate all the things from the R&R plan tool template, and it will help you really, yeah, get on it, get to the action part of all of this plan. So that's what it's there for. Like I said already, the action plan mirrors the R&R plan sections. It includes those areas for gaps and barriers, opportunities, strategies for improvement, and your timeline. And basically, this is building the instruction booklet for accomplishing the goals that you've laid out in your comprehensive workforce plan. So that's great. So now I'm going to just quickly show you each of those sections. So this is what we have for assessment. So it it lays out each of the sections of your assessment and each of the gaps and barriers, the opportunities, the strategies for improvement, and your timeline. The next is for the retention section, then for your recruitment section, and obviously that one's a little bit longer, so we've got 2 slides to show that, and then your other resources. And like everything else in the R&R plan template, it's in a Word document, so it's editable. So if this, this is only 3 things that you're thinking about. But if you have other pieces that you implement for other resources and other strategies, you can just add another line. That's good for you. So like with so many things, when addressing your strategies for improvement in your action plans, it's important to ensure that these strategies and goals are SMART, which stands for specific, measurable, attainable, relevant, and timely. So just as you're going through, make sure that you're looking and thinking, okay, does this meet the SMART goals criteria? And you can go through and, because you don't, like I said, it really helps to be accomplishing things and to actually be checking things off the list, and having them be SMART goals will ensure that you can check them off the list and that you're not setting goals for yourself that aren't going to be able to be attained or aren't going to be able to be measured, or aren't relevant, etc. So our wrap up and next steps are that we want to hear from you. You can put this in the chat. You can also just let the folks at the Virginia PCA know, but we want you to think about how often you'd like to check in on your comprehensive workforce plan progress with your PCA partners. What do you feel you need guidance or support on in the coming months as you begin to work on your comprehensive workforce plan? What might be missing from the template? If you look through it, we'd love to hear that. Like Michelle said, we're in the process of updating it. And so, as we're doing that, if you're like, oh, I definitely need a section on please let us know. And then what are your next steps leaving this workshop? And so we just want folks to be thinking about, okay, I've got a lot of information from this. What's next? What are you going to take from this? And how are you going to actually create a comprehensive workforce plan? Is it, a lot of folks said the challenge was time. Is it that this Friday you're going to block off time and tell people that you are not available and they can't bother you, and for 2 hours you're just going to actually get going on this and put the things that you already have, like Michelle said, put them into the template and get started, and that way you can be like, oh my gosh, I'm already 50% done. This wasn't as horrible as I thought it was going to be. I actually already have a lot of this information. What is it? That's obviously just one example. So while you're thinking about those questions, I also just want to highlight that we have all of our resources here. And this link at the bottom links to almost all of the STAR Center original resources. I did link the pay equity checklist, which is a relatively new resource that Michelle created. So as you're thinking about that equitable compensation, that's a really good resource to access. But the rest of these are listed on this page. Again, I'm not seeing any questions in there. So while you're thinking about your questions, we also want to encourage you / ask you to please fill out the evaluation in a little bit / maybe right now. Mariah will be linking or putting up a poll, and that is our evaluation. As you all know, we're funded by VCHA. And I know you hear this from your PCA all the time, but it's really important for us to have evaluations. It helps us be better. It helps your PCA know what they need, and it helps VCHA, be happy with us. And we all want that, right? Again, as we just finish up in the next few minutes, we want to highlight some other resources that the STAR Center has. So we have some self-paced courses that are honestly really great. I feel like they're a pretty underutilized resource that we have. So I really like to plug them. They cover a lot of different topics. We have one on like leadership styles. We have one on recruitment planning, retention planning. There's like all these different subjects, and they're great, and they're self-paced. You can start one and take a break. They're awesome. And then of course we also have a podcast series this season 3. It's on self-care for health center employees, and it focuses on how organizations can support self-care. There are 3 episodes out now. The 4th is coming out soon, so check those out. And then of course, stay in touch. I don't see any questions in the chat, but since you're able to unmute, please feel free to raise your hand or unmute to share any questions you have. And with that, I'm gonna borrow from Michelle and encourage silence while I take a sip of coffee. So I'm not encouraging silence. I'm sitting with silence while you all fill the silence.
Yeah, we're here to answer any questions. And one thing, Helen, if it's okay, that I also wanted to mention, so going back to that turnover slide, turnover will ultimately be more expensive than investing in all of this. And the workforce has changed, and we have to change with it, because if we don't, whether or not it's something we want to do, you're still going to lose your employees, and you're not going to recruit the people that you're looking for, simply because right now everything is really led by the workforce and what their needs are. And the other thing when it comes to turnover and why that cost also increases, if you have a lot of turnover, people in the health center are going to be like, why are so many people leaving? Or, somebody who's really close with someone else has left. It impacts that culture that you've built. So it's really, really important to focus in on those changes, on what the workforce needs. And it starts with simply just asking people, what do you need? What do you want? That data, that information is probably some of the most valuable information that you can collect. And then I also really encourage, as Helen said, you know, when you leave here, you have a lot of this. Just go and see what you need, or sorry, go and see what you already have and put it together in a document. Oh, thank you, Glenda.
Yeah, to your point, Michelle, about asking staff what they need, one of the sessions at the Workforce Symposium that we're holding in Nashville is on conducting staff satisfaction surveys. And then also in the next project year, we're not exactly sure when, but sometime after July 2022, we'll be holding a learning collaborative on conducting and responding to staff satisfaction surveys. So of course, it's important to just, like Michelle said, just ask folks in those moments and one-on-one meetings, et cetera. But if you want to, if you're interested in conducting a staff satisfaction survey, but not sure where to start, or you've done it in the past, but you just want to know different new best practices you could employ, we both have that session at the Workforce Symposium, and we'll be conducting a learning collaborative within 12 months.
And oh, go ahead.
Sorry, I have a question. Thank y'all for today for the information. I really appreciate it. My name is Justin. I had a question. During the recruiting portion, you had mentioned a program that could go through you're using. If you wouldn't mind linking that, I was pretty intrigued by that. So
yes, thank you for that reminder. Let me find it.
I couldn't remember if it was in a toolkit that you were going to send out or if it was a separate link. So
it's just a separate link. So yes, thank you so much. It's called Gender Decoder. And it's in the chat now. And yeah, it just has a functionality where you can just paste your text from your ad there. And it's specifically about finding subtle bias in job ads around like gendered language that we tend to use, but don't think about as gendered. And so, yeah, you can just post it there and check the ad. So I think it's really cool.
Appreciate it. Thank you.
Yeah, thanks for asking.
We did get a comment in the chat, so it was sent directly to me, but, and this is very true, providers know each other, they talk to each other, they may have gone to the same schools, same alumni. So if you have happy employees, they're the best ambassadors to get people in. As I mentioned, I'm a social worker, and I know for sure that we, you know, kind of look out for each other. We're like, don't go work here, go work here. So that's going to make a very big impact on who you're recruiting. So use what you have already. Use the people, not use, but utilize the people that are on your staff, especially when it comes to providers of all different kinds, because it really is a very close-knit community.
Awesome. Well, I don't see any other questions coming in, and we don't want to hold you here just for holding you on Zoom's sake. So we're happy to give you 5 minutes back. We really appreciate the opportunity to be here today. It was great to hang out with you all, and thanks for, I know 2 hours is a long training, but we just feel like we have so much to say about this. So yeah, thank you so much for having us. Feel free to reach out either to our individual emails or to that info at clinicians.org, which goes straight to Michelle. And yeah, we're available for TA. We're available to check in on anything, and you know, maybe we'll see you in Nashville. The food is delicious. The content is awesome.
And thank you, Bernadette. Yes, absolutely. We were so excited to be here with all of you. So yeah, get back a few minutes in your day. I know it's small, but always worth it.
Yeah. All right.
You guys did a great job. Thank you.
Oh, thanks so much.
Thank you.
Thank you so much. We're so happy to be here. All right.
All right.
Bye, everyone.
Bye.